歡迎大家出席今日嘅。
Welcome to the press briefing. With us today are Dr. Chuang Shuk Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Gladys Kwan, Chief Manager, Hospital Authority. They will brief us on the situation at the hospitals and the COVID-19 cases. Dr. Kwan, currently 1,494 patients are staying in hospital, of which 181 are newly confirmed COVID patients. Of the isolated patients, 488 are staying in isolation wards, 71 are staying in Tier 2 isolation wards, 443 are staying in the North Lantau Hospital, Hong Kong Infection Control Center. 154 were newly confirmed patients. Yesterday, 6 new patients were reported to be in critical condition, 5 were in serious condition. Of the hospitalized patients, 21 are in critical condition and 27 are in serious condition. 12 of the patients in critical condition are staying in ICUs. Earlier, a 22-month-old female baby is still in critical condition. She is staying in the ICU of Pamela Yu Nethersoul Eastern Hospital. We will continue to render support. Another 82-year-old patient passed away yesterday. He did not come from a residential care home, and there was no vaccination record. The 80-year-old male patient had diabetes, hypertension, and a fatty liver. And on the 25th of July, he visited a general outpatient clinic due to coughing. He provided a deep throat saliva sample, and later he tested positive. And on the 27th, he visited a designated clinic. He was in stable condition then, and we prescribed an oral antiviral. At that time, he did not have fever, and his heartbeat and vitals were normal. He subsequently returned home, and by July the 29th, he had fever again and he had coughing. He was admitted to the medicine ward for treatment. Unfortunately, his conditions continued to deteriorate, and his kidney and liver failed and subsequently passed away. Over the past day, about 130 patients passed away. 125 were discharged. 2 patients tested positive through admission screening or in-hospital testing. 4 other patients and staff members in the same ward had to be classified as close contacts. 26,051 staff members tested positive so far. 25,458 have returned to their posts. That's all for my report. Dr. Chuang. Good afternoon. Yesterday, we had a total of 4,455 positive cases, including 1,590 PCR positive cases and 2,865 verified RAT results. We also had 176 imported cases, 160 tested positive through PCR and 19 through RAT. As Dr. Kwan reported, we saw 1 new death today. Since the 5th wave started, the death toll stands at 9,260. Of the 179 imported cases, there were 86 detected at the airport, 74 were found at quarantine hotels, and 20 were identified after the patients left the quarantine hotels. The 179 cases came from 41 places. These 5 cases had more than 10 cases, including 34 from UK, 22 from India, 19 from Thailand, 14 from the US, and 12 from Singapore. The 36 other cases came from places with 10 or less cases. For residential care homes, 1 new residential care home for the elderly, that is Kwai Fong Gui in Kwai Ching, saw 1 positive case for a resident. 7 other residents had to be quarantined. Today is school holiday, so there were no newly reported cases, and no schools no school saw class suspension. That's all for my report. The floor is now open for questions. Please identify your organization before you speak. The lady on the front row, please. Good afternoon, this is Now TV. For the compassionate visit arrangement for most parents, can you give us the details? Some people voice online why such compassionate visit arrangement was allowed, and I'd like to know about the current conditions of Mo. This patient is still in critical condition. From what we understand, his vitals are currently stable. Our medical team will continue to monitor his conditions and attend to his needs. As for the compassionate visit arrangement, we have always had this compassionate visit arrangement at public hospitals in light of COVID. For critical patients or patients who see deteriorating conditions, if visitors can produce a valid PCR proof within the last 48 hours or a negative RT result within the last 24 hours, we would allow visits. And after they produce a negative RT result, after the visit, they should submit a negative PCR result within 2 days. In case of emergencies, they might not necessarily be able to produce neither negative result, and after the visit, they should produce a negative RT result within 24 hours and a negative PCR result within 48 hours. Meanwhile, we will do our best to support the needs of the relevant family members, because this is a very difficult time for everybody. And as such, our team would communicate with the family members of patients to find out about their needs. And in order to ensure the well-being of visitors, we would require them to observe our infection control measures. We would not comment on the compassionate visit arrangements of specific patients, but such mechanism has always been in place. For persons in quarantine, they can apply for a temporary departure from the place of quarantine to visit their family members or to take part in funeral service in funeral parlors or cemeteries. Since the 1st of April last year to the 31st of March this year, the Department of Health approved 1,240 such applications. Next question, please. The gentleman at the back. This is cable TV. For the 22-month-old baby, did her condition improve in recent days? For the 82-year-old patient who passed away, he was in stable condition on the 27th, but his conditions deteriorated rapidly. Did you find out whether it was due to COVID? For the 22-month-old girl, like we said, she remains in critical condition, and we have no additional information. As for the fatality we reported, the patient had chronic illnesses, and he visited a designated clinic, and an oral antiviral was prescribed. We are still following up on the clinical conditions, and we are unsure of the source of infection or the actual cause of death.
Let's have the next question, the lady at the front. I'm from Hong Kong 01. In February and March, did you suspend the compassionate visit arrangements? As I've said, during the epidemic, compassionate visit has never been stopped. But of course, in February and in March, if you will remember that we were in a very difficult position. Therefore, for some different arrangements might be made in the light of the water management. But I have to stress that compassionate visits has always been arranged in the system. The lady at the back.
Can you talk about the current condition of the 22-month-old baby and how's the assessment going on for vaccination for children aged under 3? As for the 82-year-old patient, can you talk about why did his condition deteriorate so quickly? And another question for the HA to follow up on hospital clusters. Is there any contingency plan if cases keep arising from hospitals? Thank you.
Okay, for the 22-month-old baby, her condition is still in critical conditions. So our medical team will continue to assess her conditions and revise her treatments. And for the 82 disease patients, and given that he has multiple long-term chronic comorbidities, and also one of the issue is that he got confirmed with the COVID, and subsequently his condition deteriorated with multi-organ failure. So probably we postulate that the COVID infection may be one of the reasons, but at this moment we still need to further study the case in great details. And concerning about the hospital infections clusterings, so we have already mentioned that we are trying to tackle this issue from various aspects. First of all, we are targeting our patients as well as our staff. For our staff now, apart from the daily rapid antigen test, they have to have the PCR test twice every week. And we already covered those colleagues who are taking care of the high-risk group patients. For example, those who work in the malignancy or the transplant patients or the infirmary or even the psychiatric patients. And these plans will continue to expand. So starting from next week, we are going to cover all the A&E colleagues as well as those who are outreach to those residential resident home. So we will review the effectiveness and see if we can further expand. And for our patients, apart from the admission screening, we are performing day 1 and day 3 PCR tests. So we hopefully that we can pick up more and more of those cases because, you know, from the community, more and more of the confirmed cases, there's a chances that through the admission screening, we can early pick up these groups of patients and get them isolated and receive treatment as soon as possible. And thirdly, of course, we reviewed our workflow and to see how the environment, the cleansing and everything within the hospital and also enhance the hand hygiene of not only our staff, but also our patients as well. Of course, we would like to take this opportunity to encourage those who haven't had the vaccination, especially those inpatient, because they maybe still have doubt or the family still have concern. So we will strongly advise if those inpatient who are still not having received vaccine, they should get it as soon as possible because they would prevent them from suffering from the critical illness and further decrease the risk of death.
One of the agenda items to be discussed at the Joint Scientific Committee meeting tomorrow is the vaccination for children. So subject to the discussion by the experts, we'll see whether there is any related vaccination recommendation in this group of children.
下一題啊，左手邊後排近中間位男士啊。
The lady at the back, the gentleman at the back. I'm from AM 730. I have a question about the compassionate visit arrangement. Was the arrangement one that they would be able to visit more once or in 7 days or a one-off arrangement? And also for the arrangement to go out during isolation, are you talking about one application for the entire quarantine period, or every time they want to go out, they to submit a new application? And what about their transport? Did they call the designated taxis, or would the government arrange transport for them? As for compassionate visit for those who have returned from overseas destinations, because it was said that they would be able to go out once, but not to any hospital. What factors would you take into account in deciding whether the applicants can go to a hospital for a visit? Or would it be depend on the nature of the ward or the categories? As for the 1,240 cases, whether they will involve multiple applications or approvals from the different cases, I have no further information. But of course, the transport is point to point. Well, when our colleagues receive such a request from the family members of our patients, we would consider them individually. As for whether they have previously contacted confirmed cases or visit high-risk destinations, that would depend on the individual situation. I cannot really generalize, but we will try to accommodate their needs in each and every case. If they have special needs, please tell our colleagues, and we will do our best to accommodate. The gentleman at the back. Left-hand side. Good afternoon, doctors. I'm from Mingpao. With regard to the visit during quarantine period, the point-to-point transport you mentioned, is it arranged by the government, or do they have to get transport themselves? And is there any time limit for each visit when they go out? And the government has said that those who are under quarantine are high-risk people and they're not supposed to visit any hospital. So when they receive a compassionate approval for visit during the quarantine period, do you require additional tests from them? As for the PCR test conducted twice per week for your colleagues, are you going to cover more HA staff in the future? Well, I'm not personally involved in the approval mechanism, but I believe that the transport is arranged by the government, the point-to-point transport, I mean. Of course, we will consider all the factors that I have referred to. As I've said, according to the existing arrangement, every visitor to our ward would need to get a PCR test first, because a PCR test is more sensitive than RAT test. And if the family member feels that he or she is a high-risk case, then we would try to advise them not to come. And if need be, they can also make use of our remote visit arrangement. So if circumstances permit, they can be arranged to get a visit. But if not, they can choose the remote visit approach. And so we have stepped up the test for colleagues working in different categories of service. And of course, we have to bear in mind the test capacity. We would review the effectiveness of the arrangement, and also, of course, in that approach, under that approach, we will have regard to our capacity.
Little man on the front row. Good afternoon. This is TVB. For the case involving a residential care home today, how old was the patient? Was he or she vaccinated? Was it a residential care home for the elderly or for the disabled? It was an RCHE. The patient received one shot of a vaccine. I have no information on the patient's age. Any other questions? Does any other reporter wish to ask a question, this is the end of the press briefing. Thank you.